I'm doing good. Go ahead.
Yeah, my question is,
Mm-hmm.
how long does the sperm survive in the vagina before pregnancy takes place?
Okay.
And what causes pregnancy to take place in the Philippine tube?
All right. They have the questions. Thank you. Even though it's slightly different from what we talked about, it's important we answer that. We'll answer that. Thank you. Good question.
Okay. Thank you. I'm welcome.
Yeah. Good morning.
Yeah, good morning. Mr. Kofi, this is Dr. Conwell.
Oh, the man with the distinctive voice. Go ahead, sir. Dr. Kunawa, yeah.
Extend our appreciation to your studio guest,
Yes.
Dr. Moses Wali and Sister Agnes.
Yes.
But I just wanted, this is a very important topic, but I just wanted to add my voice on one little thing.
Yes.
And that is, especially to our village mommy,
Mm-hmm.
they can't bring their children to hospital and give them medication for 7 days. They will take it for only 2 or 3 days. They leave the other one on their medication shelf. But you know what they call that they have today, and the boss that is responsible for that call might not be the same boss that is responsible the next month. So what they do is that as soon as the child develops that call, they grab that other medicine that is completely useless, that will create resistance, okay, and they begin to give it to their children, and then they come running to the hospital when they find out that there's no way.
Okay.
So people need to really think. I mean, pain medicine, you can stop your pain medicine when your pain disappears.
Okay.
But you cannot stop your antimicrobial treatment or the antibiotic treatment because the symptoms are going down, so you say, oh, it's gone.
Aha.
Creating resistance treatment. And almost everybody is guilty. You go to people's homes now, you find they have a little medication shelf where they got drugs that they didn't take at the last time they were giving those drugs.
Yes.
I just wanted to add that, but I also wanted to say thank you to your studio guests. They're doing an excellent job.
Okay.
Thank you, Mr. Kuti.
Thank you to Dr. Kodawa. Dr. Kodawa is the head physician at Jahmale Medical Solutions. He's proud of what his colleagues are doing here, and I like that. Thank you. All right. Let's take this one. Good morning.
Yes, good morning, sir. Mr. Kuti, how are you, sir?
I'm pretty good. How are you?
I'm doing very good.
Mm-hmm.
Going to the discussion, I'm listening, but there's a certain issue because most especially we the men, we always use our sorry for saying this because this
Go ahead.
Yeah, we always use our mouth to if you come to go doing the vagina. So I want to ask this if that's necessary for us to do that.
My brother, that's a fine question. Look, let me tell you something. What's your name again?
My name is Ian Roberts.
Okay, Mr. Rao. This show you see here is an open show. Don't just insult anybody, that's all. That's a very fine question. Most men do it. They like to put their mouth there and suck. It's not a good thing. The doctor will tell you whether it's good or not. Thank you. Good question.
Okay, sir. Thanks.
All right. Well, let's put an open place. Hello?
Yeah, hello.
Yes, sir. How are you?
I'm good. I'm in a bar and I call you from Foya District of County.
Oh, my man has for you this morning.
Yeah, Foya is quiet. It's cool and calm.
Thank you. Good to hear your voice. Go ahead, sir.
Yeah, so I'm a bit disappointed when I heard talking about, how the bacteria are building defense and then other malaria let's say drugs are no longer working, and even coming to antimeter now to really clear up malaria, you should use even injection and let's say pills. At the same time, he's telling us, or they are telling us that these medication are affecting the body. So I don't know how we can reconcile that, especially when we are blaming the new generation of promiscuity. I believe that the doctor should start making research on herbs, because I don't think it's really promiscuous, because forefathers are not accusing them. The one man used to have 10 wives, 20 wives. And that one man is kind of interacting with all those women at the same time, and they still survive because I believe they were using herbs. I think it is because of these too much toxics or toxins, and then these kind of medications that they have come that have, let's say, gotten so much on our market.
So, excuse me. Hello. What is your main point? Are you saying that they talk about people having multiple partners to be something bad because
No, it's not bad. It's not bad.
what?
They are right. But what I'm saying,
Mhm.
one of the causes of some of these things is the kind of medication, the proliferation of
Oh,
medication on
should,
our markets.
they should
So
revert
they
to
should try
herbs.
to do research on herbs.
Okay, all right. Then
Thank
listen,
you.
yeah. Thank you very much. All right.
Thank you.
Thank you. Even the WHO say herbs are good, but they're not. Anyway, hello.
Hello.
Yeah.
Good morning.
Good morning. How are you? Go ahead.
I'm good. My concern has to do with just appreciation on the matter of good bacteria because I'm on top. This is my very first time to have heard about good bacteria in human body.
Yeah.
So I just want to appreciate Nancy this morning because it teaches me a lot concerning that.
I'm happy to hear that too today. Thank you very much. Hello.
Yes, good morning. How are you?
I'm good, my brother. How are you?
I'm trying. My name is Woody Jonokele.
Okay.
I call from the Georgianville Belt.
Okay, sir. Go ahead.
Yes, I say hi to the studio guests in there. Yes, my concern is I heard them talk about the female putting hands into their private part to clean it up. I don't know. Since it is not advisable, what is the best way out?
Good question.
What is the best way out?
If she cannot put her finger in herself to clean herself, what should she do? What's the best way out? Good question. Thank you. Good morning to you.
Good morning, Cody.
Good morning, brother. How are you?
Good. My name is Arthur Loyon, pharmacist by profession.
Oh, okay. Go ahead.
So I'm just following your call and thank you for having the guest in studio.
Yes.
I think this is a very good topic. I wish they had carried along with their pharmacist to address some of the things that they have said so nicely.
Oh, okay.
But I just wanted to add one or two other points that contribute towards this antimicrobial resistance.
Yes.
I think the issue of antimicrobial resistance is not only come about by the action of patients. They are also brought about by health professionals.
Okay.
For example, what we call polypharmacy, empiric treatment, treating disease based on experience or without any established proper diagnosis. And I'm good that the laboratory technician or technology is in the studio.
Yeah.
So these are things as health workers who also need to guide ourselves against so that to control the issue of antimicrobial agent.
Where they only treat people on experience and not by research or anesthetic.
Hello?
Yeah. Okay, I think the doctors, they got your point. They got your point.
So the other issue I want to talk about is drug interaction.
Yeah.
That come about as a result of this polypharmacy.
Okay.
If drugs are taken together and they are not compatible, they will bring about actions in three forms. One drug may increase the impact of the other, or decrease the impact of the other, or the action of the two drugs working on the body may produce totally different scenarios that will affect the patient. And it's good that you talk about good bacteria. These are normal flora that have some good impact on the living tissue and body. So if you take drugs that will bring about abnormal manifestation of action, it will affect this normal flora. All right, and thereby exposing our bodies to resistance. The antimicrobial resistant to treat when the disease is already in our system.
Thank you, brother. I appreciate it. Your name once again?
My name is Arthur Loyon.
Okay, Mr. Loyon. Thank you very much for your contribution. We appreciate that. You know, when you see them not mentioning everything, it's because of the time we have here. They will say some and not say all because of the time. But anyway, thank you for your contribution. We can take just two more calls and go back to our guest. Hello.
Yeah, good morning, Mr. Foti.
Good morning to you.
Yeah, my attention is due to worm.
Worm, okay.
Worm is living within our system. It eats in our system. It comes within our system. I want to know the side effects and the benefits that we achieve from that.
from that. The benefits that we get from worms eating in our system.
And the side effect.
And the side effect. Okay. All right. Thank you. And this is going to be our last caller for today. Thank you. Good morning.
Good morning, His Excellency. Honorable David Kuti, how are you?
Oh, when I got one excellency that I Joe Bacao. You let the people hear on that. Yeah, Reverend Howard, how are you?
How are you coming on?
I'm so good. How are you?
Thank you. I want to thank you ever much again. You let me up on that radio.
Okay.
I want to say thank you to the doctor there in studio. For one question I had to ask. 1975, to be precise.
Yeah.
When we were dating the Steven Tower Estate, you know, I was a heavy duty driver.
Yeah.
And the truck and the loader have an accident together. I was put in jail for about a night.
Yeah.
Because the next night I was put in the jail, and that time we had a small big police station where the big one is now.
Yeah, yeah. You can you go straight to the question right away?
Okay.
Yeah, yeah.
And then I sat on the floor that night because I couldn't stand the whole night.
Yeah.
In the PP, all of us that were there. The next day we came. From that time, I had some kind of scratch on my back here where every time it will come, I've been to Kennedy, I've been to ELW, I've been to Florida Police Academy, and all of that. When they treat me, it get better when I come back. Every time or that year it comes. What's the cause? Is there no medicine or what? And that's what people, it will just come like what? Or something like that.
Okay.
Yeah.
All right.
I want to know what's the reason.
Okay.
And if no way to treat it, and I say injection, anything you can take,
okay.
give it to me.
Okay, Reverend.
Thank you
very much.
Thank you, sir.
I think you're talking about pie, but they will answer the question. Thank you. All right. We can't continue with the taking of calls now. We still see the phones ringing, but we can't continue with that. We only got 14 minutes left for the doctors to respond. We're back to you. You follow the
questions?
Yes.
I will start from the last one. Rash after sitting in urine. Now, the best idea of any rash is to go to a doctor. They look at the rash and either decide to do, a skin scraping or whatever it is, or KOH, put it under the microscope and look at it. If they are able to do a culture of that particular fungus or whatever it is and tell you what the medication is, then you go straight to that route.
Okay.
But I can't sit down in the studio here without seeing it and say this is the cause.
Okay.
It might be some different thing. So he has to go to a doctor when the rash is on him.
Yeah,
That particular time.
I'm coming. Just one more thing.
Yeah.
Nobody asked this question, but I want you to please do me a favor. Please announce the numbers.
We will.
I want you
close
to.
it.
No. Do it now so that we don't forget. Please give your numbers.
Okay.
Yes.
So if you want to get a direct contact with the nurse, a nurse will book you for a different specialist.
Yeah.
It's 088 160 3037.
Okay.
That's for consultation.
Yeah. Please repeat that number. Yeah.
088
088
160
160
3037.
37.
Yes.
37.
Yes.
All right.
And you can change the last digits, that's 37. You can change it to 48.
We're not changing. Just
Okay.
repeat. Say the whole thing.
The whole thing again. 088.
No, not repeating this one.
Yes.
The other number. Just
the
call
other
it.
number.
Yeah.
088 160
160
3048.
3048.
Yes. For the lab, if you want to get in touch with the lab, it's 088
Yeah.
160 3050.
Okay.
So
We'll come back to you to repeat that because people may want to come and meet you. And we don't have much time, so let's make the response.
Okay, the other question the man talked about worms. Worms are not part of our body.
Okay.
They are not good worms or bad worms. Worms are parasites.
Okay.
They feed off of you. So you got to eliminate them. They don't have no advantage
No
or
benefit.
disadvantage for you.
No health benefit.
No health benefit. They are parasites, just like malaria.
Okay.
The spread, like of antimicrobial resistance, can be from person to person, where we don't wash our hands.
Yeah.
Okay, It can be from instruments being used in a hospital or a clinic. It can be the bed used in a hospital or in a clinic. It can be the bedding or the linen or the bedspread. It can be so many different things that can cause the spread.
Okay, let's go to the next.
Okay, the next one.
I want to say a
Yeah,
little
please.
about the
Yeah.
worm. So, because of the type of food we eat in Liberia,
Yeah.
I like potato greens a lot. So, the worms always, the eggs of the worms, they always stay in between the leaves. So, if you are buying potato greens, you need to clean it very well. With vinegar or salt, you clean it very well and have the habit to deworm every 6 months.
Every 6 months.
Okay.
Every 6 months.
And that simply means take medicine for worm every 6 months.
Yeah.
Yes.
Deworm.
Especially for the children in particular.
Yeah, and you mentioned something about washing the potato grains very well.
Very well.
Now, you said with salt or vinegar. Can I wash it with soap also?
No, not soap.
No.
Not soap.
Oh.
In fact, it's one of the ways that bacteria or bugs are being transferred from person to person when we do not handle our food properly. Okay?
Okay.
We must handle our food properly and cook it properly. Okay?
Okay, let's
Now,
go.
the other question that the person said, what advice do we have for the young women that douche or the young women that clean themselves? Go to a gynecologist.
Gynecologist.
Go to a doctor.
A woman
They
doctor.
go to a
gynecologist.
doctor, they will examine you, and if there's something that is not correct, they will tell you and you'll be able to do it.
Okay.
Now, for the pharmacist the person that talk about herbs,
Before you go to that, you come back to that. This is a person sitting away in Pasadena, in Lofa County. They don't have good doctors around there. They are listening to the program right now like the fellow from Foya. They don't have, they have found out today that it's not a good thing putting your finger in yourself to clean yourself. They want to know the alternative before going
alternative, they can go to a good midwife, somebody who, or in a clinic. Go to a clinic. That's what I'm trying to push.
push. Okay. Now,
Go to a clinic or go to a place, a health center,
they will tell you what to
where they can look at you and then advise you appropriately.
do. Okay.
Okay?
Okay.
The other one says herbs. Herbs are not good. Straight up front, I will tell you. Everything that we do in life has risks and benefits. The clothes you wear has risk and benefit. The keke you ride has risk of an accident and benefit, transport you. The motorbike, but we still ride it. The food we eat can get you sour belly. It can make your stomach run, but we still eat it. So every medicine has side effect. The difference between the Western medicine and the herbs that you're talking about is the Western medicine got dose. They got frequency.
Yeah.
One 500 milligram tablet, 250 milligram tablet, 80 milligram tablet, 160 milligram tablet. Or you take it 3 times a day, 2 times a day. But the herbs will tell you take 1 cup.
Yeah. No.
You don't know what inside that 1 cup. We've seen in Liberia where Ojolobo caused renal failure. It kills the kidney.
Yeah.
So herbs are not good.
Okay.
Oral sex was not meant by God.
No.
We human beings decide to do it the same way we're doing, fingering, the same way we're doing anal intercourse, the same way we're doing bestiality, where people sleep with animals, the same way we're doing when people sleep with dead body necrophiliacs, or where old people go look for a 2-year-old child, a pedophile. That is something wrong mentally with those people. So it is not normal.
So the man who is talking about sucking or kissing the private part, they say, "It's not good. Leave it. Don't do it."
Okay, so
Yeah. Let him go ahead.
sorry, I
No,
want
go
to
ahead.
just jump in before the time goes.
Yeah.
About testing. Testing is very, very important. Sometimes when it comes to
Testing, doing a test.
doing a
Oh,
test,
okay.
culture and sensitivity test,
Yeah.
we can actually give the doctors some blame when it comes to this, because naturally what doctors do is when the patient presents with the symptoms, they want to reduce it because maybe they don't have the culture and sensitivity test available.
Yeah.
It's very good to let the patient wait and get the reports from the lab.
Yeah.
Get the culture and sensitivity report that will tell you this particular bacteria
Can be
is
treated
sensitive
to this.
to this antibiotic.
This antibiotic resistant to that
Exactly.
antibiotic and that antibiotic.
Yes.
Okay.
So wait for it. It's better you wait 1 or 2 days
Then.
and get the best antibiotics for that infection.
That is the importance of laboratory.
Yes, then just going broad spectrum antibiotics and make it even worse for the patient.
I agree with you.
And the last question says, it was the first one. Normally, spermatozoa lasts between 48 to 72 hours in the vagina.
In 30 seconds, sir.
Okay. The egg that is produced by the woman lasts about 24 hours. Okay. But the fact of the matter is that pregnancy is supposed to happen way up. The zygote or the fertilized egg travels through the fallopian tube. Now, if for instance there is a blockage in the fallopian tube from gonorrhea or from old chlamydia, that egg that is fertilized is not able to come down to the uterus, to the womb, to the room where the baby is going to grow.
Yeah.
And it gets stuck there. That's what we call tuber pregnancy, which he was asking about. Okay? So, the normal place for the baby to start growing is the womb.
It's a womb. Thank you very much.
Okay.
We keep going to follow. Your last comments, please.
Okay, the last comment
30
is about
seconds.
the oral sex.
Yeah, okay, yeah.
So you might think that you wouldn't contract anything from oral sex. We actually have candida of the mouth. We have herpes of the mouth. So you can actually get a lot more infections. When
Even
you use your
cancer.
mouth. You can get cancer
From sucking.
Yeah.
A woman's private part.
Yeah, because you
So
can get
stop it.
you can get human papilloma virus
Yeah.
from down there.
HPV,
You
which
can get herpes, as she said.
Yeah.
And if you get a cut, you can even get HIV.
HIV from there. The woman has beautiful lips. Kiss the lips, my friend, and scalp the other side. Thank you very much for coming. I hope to bring you back. This topic today, I think it's very good, like all of the other topics, but this issue is bothering most of our young girls today. They don't know, and I hope they were listening. I will find a time one day to just repeat this program so that the girls or the ladies can listen. Even all women, listen and tell your children. Well, thank you for coming.
Thank you.
And please repeat your numbers once more.
088
088
160
160
30
30
48
48
088
088
160
160
30
30
37.
37
For the lab, 088
088
160
160
30
30
50.
50. Well, thank you. Those are my guests today. Agnes Anyali, the head of the laboratory department, and Dr. Moses Tarawali. He's one of the medical doctors at the GFK. At the Jahmale, I'm sorry. He's actually assigned at the Nuclear branch, which is a very, very sophisticated area also. They do a good job there. Thank you very much for listening and have a good day. We'll be here next week. Bye-bye.